Hi, my name is Nikki Soda, and I am the Membership and Advocacy Officer here with NAATP. And I have the privilege this morning to be visiting with Colleen Munkel, who is the Director of Business Development for Pine Grove. Thank you so much for taking time out of your day to talk with me. I was hoping that you might be able to tell us a little bit about Pine Grove and the history of Pine Grove and what exactly it is that the treatment that you provide.
Well, Pine Grove is located in Hattiesburg, Mississippi, which is in South Mississippi, and our full name is Pine Grove Behavioral Health and Addiction Services. And we're actually the behavioral healthcare extension of Forest Health, which is a large nonprofit healthcare organization located throughout South Mississippi. And Pine Grove was actually established back in 1984. So we are actually celebrating our 37th anniversary this year. And Pine Grove is very proud. While we're located in South Mississippi, we're very proud of that. We're known as one of the nation's most comprehensive treatment campuses. So we provide a wide variety of care in terms of levels of care and highly specialized programs. We treat children, adolescents, and adults here at Pine Grove. So we provide inpatient psychiatric care for adults, children, and adolescents. We also have a full array of services on an outpatient basis for children, adolescents, and adults. And then we also have a number of specialty addiction treatment programs that, of course, focus on treating substance abuse in men and women. Our Women's Center also treats, in addition to substance abuse in women, the Women's Center also treats trauma and co-occurring eating disorders and compulsive sexual behavior. Our Next Step men's program treats men ages 18 to about early 50s, treating substance abuse. And then we also have another highly specialized substance abuse treatment program named Legacy. And that program specifically treats men and women ages 55 plus who are suffering from substance abuse and addiction. We also have a highly specialized program named Gratitude, which was established in 2004 and was one of the first programs of its kind within the country that specifically focuses on treating compulsive sexual behavior in men. Pine Grove is also well known for our treatment of licensed professionals and our professionals treatment. So whether that is physicians, attorneys, nurse practitioners, any type of professional that would report to a professional licensing body. We have a specific program named our Professional Enhancement Program, otherwise known as PEP, which really specializes in the treatment of professionals. And then, of course, all of our addiction treatment programs at Pine Grove have professional treatment components for licensed professionals that are in treatment at Pine Grove. We also have a comprehensive evaluation center where we provide a number of different types of professional evaluations, whether that is an addiction evaluation, a psychosexual evaluation, other comprehensive cognitive evaluations. And then we also have a number of intensive workshops at Pine Grove as well. So we have a wide variety of programs and services here that we're very proud to provide.
And how lucky Mississippi is to have you there to be able to really cover such a wide spectrum. So that's wonderful. Colleen,
Well,
how have so COVID has impacted and affected everyone. What are some of the things that Pine Grove has really had to pivot or adjust during this last year, during the pandemic?
Certainly the COVID-19 pandemic has been an adjustment for healthcare providers across the country, and Pine Grove is no exception. Our team really worked very, very hard together in the early stages of this pandemic to make sure that we were able to continue to provide necessary care to people that were seeking treatment at Pine Grove. So we never closed any of our programs throughout this pandemic. We did make sure to adhere to all safety guidelines and protocols. I do think it's important to note, while I mentioned in the beginning that Pine Grove is the behavioral health care extension of Forest Health, Forest Health also encompasses a number of large hospitals. And of course, our flagship hospital is Forest General Hospital, which is a large regional trauma 2 level hospital. And adhering to COVID-19 protocols is of the utmost importance. And we've been able to do that at Pine Grove while continuing to treat patients throughout this entire pandemic. Some of the things that we did was certainly we make sure all patients that are coming to treatment here at Pine Grove who are traveling into Pine Grove for care receive a negative COVID-19 test within about 5 days of their admission to Pine Grove. So that's certainly important. Or of course, proof of the vaccine now, as many people are now able to be vaccinated. We also were able to greatly expand our telehealth services during this time. So for example, many of our outpatient services, we're also able to provide those on an outpatient basis. So I think that that's important. And we really rallied as a team to make that happen very, very quickly. And of course, as everybody knows now, over a year into the COVID-19 pandemic, the expansion of telehealth has just been significant. And that is certainly something that many people have now realized they enjoy and they want to continue to pursue telehealth services beyond the pandemic. So we were able to do that. We were also able to do a number of other programs that I think, as always, we're able to keep patient care at the forefront while continuing to provide essential patient care. So certainly we've maintained treating patients throughout this pandemic, but we've also been able to provide services to their family members via telehealth and really take advantage of that and to continue our programming and our support services throughout this pandemic, albeit in a different form. And so that's been important. So we've been able to maintain all of our alumni events for our patients throughout this entire pandemic and really offer concentrated programming and resources for our alumni and outreach to our alumni through our alumni team during this pandemic too. We've also started an aftercare group that's facilitated by our alumni program, where alumni from all over the country, and of course certainly where we're located here in Mississippi, are able to receive ongoing recovery support. That's very important to us, that we're able to maintain those relationships and to continue to provide care to our alumni, and of course the family members of our patients that are currently receiving care here at Pine Grove. So we've really been able to take advantage of the opportunities that telehealth provides, and that was really essential during this pandemic.
Have you found that alumni engagement has increased over this last year?
Yes, actually we have found that. We found that they really enjoyed the telehealth options and programming that they're able to engage in through our alumni program. Now, prior to the pandemic, we had alumni events on campus, but of course, due to our alumni and their professional schedule, certainly not all alumni are always able to come to every in-person event. So being able to offer these telehealth options is important because we're able to offer greater outreach to our alumni that are located throughout the country. And that's actually something that is here to stay as well. While we're probably going to return to on-campus alumni programming within 2021, while of course maintaining adherence to all COVID-19 guidelines and protocols, we are going to offer that hybrid telehealth option as well, that virtual option for our alumni too, because it enables a wider audience to be able to continue to receive support from Pine Grove. In the very early stages of the pandemic, I would say March, April, May of 2020, Pine Grove launched a statewide mental health support line to everybody in Mississippi to be able to call Pine Grove and to be able to receive mental health care and addiction resources in their community, as well as some practical supportive advice that our team was able to provide for people, because certainly this pandemic impacted everybody's daily lives in ways that I think we're probably still processing and coming to terms with. But that's something that we were able to do because we do have a team that serves our entire state. We have offices located in a variety of Mississippi cities. So we were really able to serve as a resource for our state as well. And we're very proud that we were able to do that too during the pandemic.
What a wonderful resource and gift. When did that hotline get launched, Colleen?
It got launched in the spring of 2020. We immediately thought about what we could do to help our community and to help our state and to gather necessary resources. And of course, for anybody who calls Pine Grove, we will always provide resources for anybody who calls us, regardless of where they are from. We want to do our part to help our state and help our community. And then, of course, Pine Grove, we provide the employee assistance program for our hospital system. We were really able to also help from a mental health care standpoint, all of our first responders within our Forest Health system as well.
Oh, that's wonderful. And I'm sure that just imploded with need as well. Pine Grove Behavioral Health has been very vocal about destigmatizing language. And could you talk a little bit about the phenomenal work that you guys are doing? You're providing a number of resources, and I'd love for you to talk a little bit about that.
Appreciate you asking me about that. Thank you very much. Yes, Pine Grove is actually right now working very hard to destigmatize addiction. We do not want people to feel shame or embarrassment when it comes to reaching out for help. We want to encourage people who may be suffering from addiction or family members, those that love somebody who's suffering from addiction, to reach out for help and to not feel barriers to that. We know that this pandemic has really impacted people in their support systems because, of course, everybody is being told to isolate during this pandemic. And we want people to continue to maintain human connection. And we know that addiction, we know that overdoses have greatly impacted the entire country. And of course, our own hometown community here in Mississippi. And we're really working through educational videos, interviews, and providing other resources to people about the importance of reaching out for help and really working hard to destigmatize addiction. And we really don't want people to feel shame or embarrassment. This is a serious issue. It's an essential issue, and we want people to reach out for help. So that's really something that we're working on very heavily right now.
It's incredibly needed, and it's wonderful to hear the work that you are putting out in regards to that, because it's not only imperative right now, but it is going to be in the future. And so many people have been affected by COVID, and it's such a tricky balance of social distancing and staying away, yet staying connected. And so the resources that you're putting out are just going to be extremely beneficial. So thank you for that.
Thank
you so much, Colleen, for your time today. It's been a wealth of information, and I encourage anyone who's listening to click on the link, and you'll be able to find out more information about Pine Grove Behavioral Health. So thank you so much, Colleen.